Hi friends, this video is going to be on Telfast D. Telfast D has Fexofenadine 60 milligrams and Pseudoephedrine HCl 120 milligrams in every tablet. The box has 10 film coated bi-layer tablets. It's made by Sanofi Pharma. The price for the box is 157 rupees. The combination of Fexofenadine and Pseudoephedrine is used in adults and children 12 years of age and older to relieve the allergy symptoms of seasonal allergic rhinitis, hay fever, including runny nose, sneezing, congestion, stuffy nose, red, itchy or watery eyes, or itching of the nose, throat or roof of the mouth. Fexofenadine is in a class of medications called antihistamines. It works by blocking the effects of histamine, a substance in the body that causes allergy symptoms. Pseudoephedrine is in a class of medications called decongestants. It works by drying up the nasal passages. The combination of Fexofenadine and Pseudoephedrine comes as an extended release tablet to be taken by mouth. The Fexofenadine and Pseudoephedrine 12-hour tablet is usually taken once or twice a day on an empty stomach with water. Fexofenadine and Pseudoephedrine controls the symptom of seasonal allergic rhinitis but does not cure the condition. Continue to take Fexofenadine and Pseudoephedrine even if you feel well and are not experiencing these symptoms. If you wait too long between doses, your symptoms may become worse. Swallow the tablets whole, do not split, chew or crush them. This medication may be prescribed for other uses. Ask your doctor or pharmacist for more information. Take the missed dose as soon as you remember it. However, if it is almost time for the next dose, skip the missed dose and continue your regular dosing schedule. Do not take a double dose to make up for a missed one. Fexofenadine and Pseudoephedrine may cause side effects. Tell your doctor if any of these symptoms are severe or do not go away. Headache, nausea, stomach pain, heartburn, dry mouth, throat irritation, back pain, pale skin. Some side effects can be serious. The following symptoms are uncommon, but if you experience any of them, call your doctor immediately. Nervousness, dizziness, difficulty falling asleep, weakness, fear, anxiety or tenseness, seizure, fainting, blurred vision, hives, etc. Fexofenadine and Pseudoephedrine may cause other side effects. Call your doctor if you have any unusual problems while taking this medication. I hope you like the video. Please like and share our channel. Subscribe to our channel. Thank you.